Hi, all, and welcome. This is Professor Truelove's Concepts for Nurses series, and I am Professor Terry Truelove. And in today's episode, one of the rehabilitation episodes, we're going to look at the assessments required by the rehabilitation nurse in order to provide quality care for their patient. Sources for this episode include Iggy's Medical Surgical Nursing 9th edition and Soul's Introduction to Critical Care Nursing 7th edition. So it is very important, particularly upon admission to the rehabilitation program, that the registered nurse perform a thorough, comprehensive assessment, which includes a cardiovascular and respiratory assessment. The nurse should look for signs and symptoms associated with a decrease in cardiac output. Are there signs of shortness of breath, chest pain, or severe weakness and fatigue? For a patient showing fatigue, you should plan methods for using limited energy resources, that is, things like pacing and rest periods. Gastrointestinal and nutritional assessment should monitor oral intake and the pattern of eating. Look for signs associated with things like anorexia, dysphagia, signs and symptoms of nausea and vomiting, or discomfort or exclamations of discomfort when eating. Note if the patient has dentures or artificial dentition. Review the patient's weight, height, their hemoglobin and hematocrit, their serum prealbumin, and their blood glucose levels, all of which are quality indicators for a nutritional assessment. A common problem in the rehabilitation setting, usually due to a sedentary or inactive lifestyle and the use of opioids for pain control, is constipation. Determine whether any alteration in bowel pattern is due to a change in diet, activity pattern, or medication use. When assessing the kidneys and urine output, look at baseline urinary patterns, including, does the patient have nocturia? That is, do they awaken at night to empty the bladder? Is there the presence of urinary incontinence or urinary retention? Monitor for urinalysis, culture, and sensitivity for patients who you suspect may have a urinary tract infection. A neurological and musculoskeletal assessment includes motor functioning, sensation, and cognition. The presence of paresis, that is weakness, or paralysis, that is the absence of movement. Observe the gait if the patient is ambulatory. And note if there are any sensory perceptual changes. For instance, if the patient is reporting things like tingling, numbness, or unusual feelings or sensation not normally associated with either positioning or therapies. Note the patient's visual acuity and provide with sight test if necessary. Determine the patient's responses to things like light touch, hot or cold temperature, and neurological insults can change the way a patient positions themselves. So, look for position changes in the extremities and in the trunk. Then determine range of motion and the endurance level of your patient. Carefully assess the patient's skin integrity and use skin assessment tools such as the Braden scale, the urinary assessment should include a post-void residual assessment, or a PVR. A PVR is the amount of urine remaining in the bladder within 20 minutes of voiding. If there is too much urine in the bladder, this means the patient's suffering from urinary retention, and of course, the problem there is they could then suffer from a urinary tract infection. As mentioned earlier, a frequent problem with elimination is constipation. This could be because of a reflex, that is a spastic bowel, which is from upper motor neuron disease or injury. Defecation occurs suddenly and without warning. In a flaccid bowel, which occurs because of a lower motor neuron disease or injury, defecation occurs infrequently and in small amounts. And in an uninhibited bowel, and this is because of a brain injury, there is frequent defecation, urgency, and hard stool. Besides the physical assessment, it is important that the nurse perform a psychosocial assessment to determine the patient's body image and self-esteem, the use of any defense mechanisms to help cope, their response to loss, the presence of any stress-related physical problems, including cardiovascular or respiratory issues, and the availability of support systems, such as family, church, or other community resources. A functional assessment really determines the patient's ability to care for themselves. So, the nurse should look at the ability of the patient to perform activities of daily living. And these include things like phone use, shopping, preparing food, housekeeping, and giving themselves water. Now, you may use a tool such as an FIM, which is called a functional independent measure. It determines how independent, given the patient's condition and disabilities, the patient can be without assistance. So the focal points of these functional assessments include self-care, sphincter control, mobility and locomotion, the ability to communicate properly, and proper cognition for safety. Remember, the goal of rehabilitation is to have the patient adapt as much as possible to their condition, and therefore a vocational assessment is indicated. Remember that vocational counselors can help find meaningful training, education, or employment after discharge, and the Americans with Disabilities Act, or ADA, prevents employer discrimination against disabled people. So once the vocational assessment and the functional assessments have been completed, this can help guide the patient and their family to determine the best route of vocation, that is, employment, that they can find, that they can perform, and be a functioning, helpful member of society. That does conclude this episode, but have no fear, there are more episodes to come. In the meantime, I hope you were able to learn a little bit. I hope you plan on coming back to listen to some more, and if you are, we'll see you then. Take care now.